Hi, Nancy. Hello, Tara. Hi, Amarani.
Hey. Can you hear me?
I could hear you. Yeah, thank you.
Okay. I don't know why it said, oh, okay.
Hey, Carly.
Hi.
All right. Hi, Lolly. Hi, Sabrina.
Hi.
Hi, Brittany.
I'm like, why is my video not
Give it about another minute or so. Wait for everybody to join before I get started. Hi. Is that your little girl?
Say hi. You wave?
So cute.
He's cute.
Thank you.
He's so cute.
All right. You're okay.
All right, everybody. So it's 5:30. I'm going to go ahead and get started. Today, we're going to be talking about chapter 16, as well as chapter 4. So without further ado, I'm going to go ahead and share my screen. And that way you guys can see what it is that I want to share. Okay, can we see that okay?
Yes.
Awesome. Okay, let me just flip to my page that I want here. So chapter 16, we're going to be talking about emergency management. So there's things that can happen in the dental office, emergencies that you want to know how to manage. So in this chapter, we're going to describe several different emergency situations. We'll describe what CAB means and how it refers to CPR. We'll define some terms in anatomy used with CPR delivery. We'll list several causes of airway obstructions and how to deal with those in the dental office. We'll list and describe some signs of treatments like syncope, angina, allergic reactions, hyperventilation, epilepsy, diabetes, things like that. We'll list and describe several dental emergencies that a patient may have, such as pain in their jaw, infections, broken teeth, a Volz tooth, which is when they had a severe accident causing their tooth to come out of their mouth, soft tissue injury, loose crown or a crown that fell off maybe. And we'll explain how a pulse oximeter, a capnography, electrocardiography work, and how they can be used in the dental office. So routine preparedness for dental team members includes rehearsing medical emergencies. So you want to go through with your teammates to know all the different medical emergencies that can happen, and you want to establish roles for each employee. So everybody on your team should have some type of role that they're going to rehearse. Like, for example, somebody may be the person to flag down an ambulance. Somebody may be the person to grab the oxygen cart. Another person may be the one to call 911. So everybody gets a role. Okay, you also want to check the emergency kit and equipment regularly. You want to make sure that we have all the everything that we need to handle these emergencies. Make sure that we have medicines in the medical kit that are not expired. You want to post emergency contact numbers, and then also post directions to the office. And that's important because if you're that person that's calling 911, you want to be able to direct the emergency team to the office. And if there's panic, you may suddenly forget where you're located. So having directions posted to the office can help you quickly get the fire department or paramedics to the office. So an emergency can occur at any time, and the entire dental office team needs to know how to respond appropriately at a moment's notice. So a routine should be established and practiced so that when necessary, a routine can be implemented and everyone involved will know exactly what to do. So the dental assistant can play a key role in the prevention of and response to emergencies occurring in the dental office. The dental assistant should observe patients for any abnormalities or discomforts or concerns. You want to report any issues of concerns to the dentist, and you want to review the patient's medical history and know what the emergency plan is, how to implement it, and what his or her role in the implementation of the plan is. So these are just a few different examples of what an emergency kit should have. So every kit should have a blood pressure kit, an oxygen kit, whether it's an ambu bag, which is what we see here in this photo here, or an actual oxygen cart. You want to have some sterile syringes available in case the doctor needs to administer some type of medication intravenously. You want to have a tracheotomy needle. Okay, that's because a lot of times, sometimes, especially in the dental office, we're working with different materials, gauze, dental dams, things can get dislodged, or excuse me, can get lodged in a patient's throat, obstructing their airway. So if that happens, a tracheotomy needle will be basically when you puncture their throat, so you get make a passageway for the trachea. Okay, obviously you wouldn't be the one person to be doing this, the doctor would, but you want to have the necessary supplies in case something like this needs to happen. Okay, also the kit should include latex gloves and masks. Nowadays, more and more offices are using nitrile gloves because a lot of people have a latex allergy. You want to have a pocket mask in case you need to administer CPR. That'll help so that you won't have to do any mouth-to-mouth contact. Okay, a cold compress and a blanket are also necessary. Okay, a paper bag is used to treat hyperventilation. Hyperventilation can be caused by stress or anxiety. And for this, you want to have the patient breathe into the paper bag. If you don't have a paper bag, cupped hands may be used, so you can have them breathe in and out of their hands. What this does is it increases the carbon dioxide in the blood, and it'll help to relieve that hyperventilation to get the patient more calm, so basically they don't pass out. Okay, some drugs in the emergency kit should include epinephrine. Epinephrine is just another word for adrenaline, which is a natural hormone that the body creates on its own. It's used for acute allergic reactions like anaphylactic shock. A lot of times the office will carry a preloaded syringe known as an EpiPen. And this is classified as a vasoconstrictor. So what it does is it constricts the blood vessels, which serves as a cardiac stimulant, and it actually relaxes the bronchioles, so the tubes in your lungs that help the patient breathe. So epinephrine is used to, once again, to relieve allergic responses. It's a natural hormone produced by the adrenal gland. And just to break up the words epinephrine, epi means upon, and then nephros means kidneys. So the whole word epinephrine is used to describe a drug that reacts upon the kidneys. Okay. Any questions with this so far? No? Okay. All right, so a bronchodilator is one of the bronchodilators that can be used as albuterol. So this is in the form of inhaler. And so what this does is it improves the airflow. It usually does not stimulate the cardiovascular system. So with the bronchodilator, you want the patient to exhale first, get all the oxygen out of their lungs, and then you want to have them breathe in while dispensing the drug. So it's a kind of a motion. And then it should be repeated again within 1 to 2 minutes. And then after that, breathing should improve. And if it doesn't within 15 minutes, you want to call 911 and administer oxygen to the patient until the paramedics arrive. So antihistamine is used for allergic reactions such as edema, erythema, urticaria, or angioedema. So it counteracts the effects of histamine. And histamine is present in the body. It consists of an amino acid and a histidine. And when the tissue is injured, it reacts by creating a flushing. So it's like almost like the immune system overreacting. And so what antihistamine does is it counteracts the effects of histamine. And Benadryl is a common type of antihistamine that's used. And it's usually administered by a liquid, and there is an injectable Benadryl or antihistamine that's used, and they even make an inhaler, and all of these should be kept in your emergency medical kit. Anticonvulsants include diazepam, which is the generic name for Valium. And this is usually given as a pre-med in tablet form to manage stress or anxiety. So patients will usually get a prescription from the doctor prior to their dental appointment if they're very, very anxious or unable to come in for a procedure due to their level of anxiety. However, it also comes in an injectable form, and it's also used to control seizures. So if a patient is having a seizure, the doctor will want to inject diazepam to help control that. Okay, analgesics include Demerol or Talwin. It's usually administered by an injection, and it's used to manage acute pain or anxiety. Another type of analgesic is nitrous oxide. A lot of people know this as laughing gas. So the laughing gas or nitrous oxide is used for acute anxiety. It does not deal with pain, but if somebody has really high anxiety and they just overreact themselves to dental treatment, a lot of the times that can be used to help them get through the procedure comfortably. Vasopressors are used to manage blood pressure. These include Vasoxil or Wyamine. These manage hypotension or low blood pressure. And so what it does is it increases the blood pressure so that it's at a safe level, and it's usually administered by an injection. Okay, and antihypoglycemic is for the management of hypoglycemia, which is a fancy word for low blood sugar. Okay, so if patients have some type of diabetes, and let's say they took too much insulin, they didn't get enough to eat, or for whatever reason they're experiencing, low blood sugar, you want to have things like a tube of cake icing, can be orange juice, cola syrup, sugar packets, and these are things that can be used to quickly elevate the patient's blood sugar so that it's no longer hypoglycemic. Nitroglycerin is used to manage chest pain. Okay, so it is a vasodilator. So what it does is it dilates the blood vessels, and the routes of transmission are translingual, sublingual, and transdermal patch. So translingual means, well, first of all, let's break up what trans means. Trans means across, over, or through something. So in the translingual, that would mean over the tongue. Lingual is another term for the tongue. Sublingual would be underneath the tongue. And then transdermal, dermal is another word for skin. So transdermal would mean through the skin. So it's a patch that patients, or you'll put on a patient so that they'll, it's supposed to relieve chest pain if they're having chest pain. Okay. Spirits of ammonia are used to manage syncope, which is a fancy term for fainting. Ammonia inhalants are used, and they should be taped to something in every room. So every operatory should have an ammonia inhalant, usually taped to the top of the light or on the patient chair. And what it is, it's usually a glass tube that's covered with gauze. And so if a patient faints, what you'll want to do is you'll want to break it under the patient's nose. And so how many of you, obviously we all know what Windex smells like, right? Anybody don't know what Windex smells like? So yeah, so what ammonia is, if you can imagine Windex, but very, very strong. And it's so strong, it'll actually burn your nose. And so you put that underneath the patient's nose for them to breathe in. And if that don't wake you up, I don't know what will, because it's very, very strong. And so, yeah, you always want to have that in every room, just in case patients faint. And we never really know why, but we don't want them to stay fainted. We want to wake them up. Okay, here's a quick dental check. So who can tell me which emergency drug may be given to a patient experiencing chest pain?
Nitroglycerin.
Nitroglycerin. Yes, you're right. Good job, Amarani. Yeah, so nitroglycerin is the first drug you want to give to somebody that's experiencing chest pain. So if somebody's experiencing chest pain, we don't know if it's just angina, or it could also be a heart attack, and I'll get to that in a moment. But the first plan of attack is nitroglycerin. Hopefully that'll bring down their chest pain. And if that doesn't, then they're probably having a heart attack, and we'll get to that in a second. So good job. All right, so if a patient stops breathing or for whatever reason loses a pulse, CPR, hang on, Alexa thought I was talking to her. 1 second. Alexa, stop. I hate it when she does that. Okay, sorry about that. So CPR is known as is short for cardiopulmonary resuscitation. So this is the first order of business to activate. The first order of business is you want to activate the EMS, which is the emergency response or emergency medical system. Basically, what that means is you want to call 911. So you want to phone first and you want to phone fast. Okay. Every person and the dental staff must be certified in CPR. And then CPR is usually recertified every 2 years. So these are some of the, I guess, acronyms of CPR, known as CABs. It used to be called ABCs, airway, breathing, and chest compressions. However, it has been changed to CABs because we want to go in order of what is the most important. Okay, so the first order of business is you want to do chest compressions, airway, and then breathing. So if the patient is unconscious, you want to locate the trachea. Okay, so find this trachea is right. Is that kind of like almost feels like a vacuum hose? Okay, and then you want to use 2 or 3 fingers along the groove of the neck, and you want to feel for the carotid pulse. Do this for about 5 seconds, but no longer than 10. Okay, if there's no pulse, you want to immediately begin CPR. So what you want to do is you want to place the heel of one hand over the center half of their sternum. So it's right in the middle of their chest. And then place the other hand directly on top. So I can't do it, but you want to do something like this where you want to clasp the hands over each other. Okay. Straighten your arms like the person in the picture is doing, and position your shoulders directly over your hands. And you want to begin cycles of 30 chest compressions at about 100 beats per minute pace. Okay. And then after that, if you're the only person doing CPR, you want to do 30 chest compressions and then 2 breaths. Okay. Every time you do a chest compression, you want to press down at least 2 inches with each compression. Okay, doing that will effectively pump the heart for the patient if their pulse is stopped. The new guidelines for life support suggest a 30 to 2 compression to ventilation ratio. If there's a single person rescuer, let's say you're the only person available to do CPR. If there are 2 people, which is more ideal, you want to do 15 to 2 compressions to ventilation ratio. So 15 compressions and then 2 breaths. Okay, and with that, you'll have the person, if you have 2 people, you want to have the person switch out every couple of minutes so that you won't get tired. Other notes are you want to ensure there's an open airway. So what you want to do is you want to tilt the head back and lift the chin. So this will open their airway, and you want to do this before you deliver any breaths. It's advisable to use a barrier device if available, like the patient that's on the floor is wearing. It's just basically a plastic covering that goes over the mouth with a hole in it. That way you're not getting in people's germs, especially in the age of COVID. We don't want to unnecessarily expose ourselves, but we also want to be able to rescue a patient if they need our help. Okay, there are technical advances that have been made, especially with defibrillators. They are now automated and they're called AEDs. And so what those are, it's basically a defibrillator. Every office should have one. As soon as somebody becomes unconscious, the best thing to do is to hook that up. So it comes with 2 patches. You'll place 1 patch on their chest for an adult and 1 patch on their side. And so what it'll do is it'll automatically detect if the patient has a pulse, and it'll talk to you. It'll, if there's no pulse, or if it detects the heart is under fibrillation, to where basically it's not pumping, but it's almost like vibrating, and it's doing it without any effect actually. It'll deliver shocks, it'll tell you to stay clear so it can deliver a shock, and then it'll tell you to continue with CPR. So it's a good tool to have in your office, so it can help to save a patient's life if need be. Okay, and usually there's in-office training to learn how to use one. They're not very difficult to use, and almost all AEDs come with training patches. So you can do trainings on them, learn exactly how to use them, things like that. Any questions with any of this so far? Oh, okay. Okay, so now we're going to talk about foreign body airway obstructions. These are also known as FBAOs. So this can happen during dental treatment where materials fall into the throat. Some common problematic materials are crowns, cotton rolls, gauze. So basically oxygen is essential to survival. And if oxygen is cut off or decreased, the patient will be at risk. In the dental office, the risk of an FBAO is great. It's pretty high due to the materials and instruments falling into the oral cavity during procedures. Okay, hopefully this doesn't happen. We use great precautions, especially when dealing with small things that can fall down the throat. We'll ligate stuff with floss. Basically, we'll tie it with a string of floss. We'll use throat packs like gauze that kind of covers the back of their throat, dental dams. The high volume evacuator. If you're an assistant and you're carrying that high volume suction, you always want to be ready to shoot down into the mouth, down to the throat if something falls back there and catches it. You want to catch it before it obstructs the airway. Okay, if there is a patient that becomes that has an obstruction and they're conscious, what you want to do is stop the treatment. You want to sit the patient upright, and you want to encourage them to cough. And if necessary, you want to perform the Heimlich maneuver. Okay, so here we have somebody performing the Heimlich maneuver. They are delivering subdiaphragmatic thrusts, and this is for a conscious adult. Obviously, you wouldn't do this for somebody that has become unconscious, or if they're conscious but they can't cough it up. You want to go ahead and do this. So what you'll do is you'll stand behind them. And then you want to put your hands right below their rib cage, and you want to give some nice strong thrusts. You want to push in. The idea is you want to push whatever it is out. So hopefully that will dislodge whatever is in there. Okay, if the patient becomes unconscious, you want to lower the patient to the floor or lay the chair back all the way. And then you want to attempt to visualize and remove the obstruction, or provide rescue breaths if you can't. If the airway is still obstructed, you want to perform chest thrusts to clear the airway. And then continue giving CPR if necessary. Okay, so here we have somebody lowering the victim to the ground and beginning CPR. Remember your CAB, so chest compressions, airway, and then breaths in that order. So do not check for a pulse in this situation. You want to begin compressions immediately. And with each breath, you want to open the mouth wide and look for the object. If it can be easily removed, you want to do so with your fingers. And if the object remains lodged, you want to continue CPR until the paramedics arrive. All right, who can tell me what is the proper order for performing cardiopulmonary resuscitation?
Chest compressions, airway, and breathing.
Very good. Thank you, Amarani. So yes, chest compressions, airway, and breathing in that order. All right. So going on to some other emergencies, there are a variety of medical conditions that can prevent themselves or present themselves in the dental office. So the dental assistant must be prepared to handle any of these emergencies that arise, no matter the cause. So these can include syncope, asthma attacks, orthostatic hypertension, allergic reactions, anaphylactic reactions, and hyperventilation. Okay, they can also include seizures, diabetic emergencies like hypoglycemia, which is another word for insulin shock or low blood sugar, and then certain cardiovascular emergencies that we'll go over. Okay, syncope is the most common and least life-threatening emergency that occurs in the dental office. So what this is when you have decreased blood flow to the brain, so patient faints, or it can happen for if you're lying still for prolonged periods. It can also be brought upon by stress, whether it's emotional or physical. Okay, some signs or symptoms of syncope is the patient can be nauseous, they can be dizzy, they can have extreme weakness, they'll appear pale or they'll have clammy skin, or even shallow breathing. So if the patient is conscious and they have syncope, but they're exhibiting signs that they have syncope, you want to seat the patient up and have the patient lower his or her head between his or her knees. So you want to have the head lower than the heart. If the patient has fainted completely and is unconscious, but they're breathing, you want to place the patient in the Trendelenburg position and administer oxygen and spirits of ammonia. Loosen any clothing or oxygen or jewelry, and then give them that oxygen and ammonia. So what does the Trendelenburg position look like? This is what it looks like. Okay, another word for Trendelenburg position is a subsupine position. Basically, you want to have the head lower than the heart. Okay, so asthma. This often exhibits in young children, and many people grow out of it as they age, but many people don't. Asthma is generally induced by an allergic reaction or to stimulus entering the airways, such as pollen, smoke, or animal dander. And the body reacts to the stimulus by narrowing the airways, which causes difficulty in breathing. So to treat asthma, antihistamines can often help. So patients with a known history of asthma should always bring their own inhaler to the appointment. If they don't, an inhaler or rescue inhaler should be kept in your office's medical or emergency medical kit. You want to give them oxygen, try to calm the patient down. And if the oxygen and or the inhaler isn't working, you want to call 911 if the condition worsens or doesn't improve within 15 minutes. Okay, orthostatic hypertension is a loss of consciousness or levels of consciousness when sitting upright quickly. So if any of you have ever crouched down for long periods of time and then suddenly you stand up, how many of you become dizzy? Or anybody have kind of seen that? Yeah, or felt that. So that is what is called orthostatic hypertension. So this may also happen in the dental office when they have been lying for a long period of time, or especially during a procedure, and then suddenly you sit them up quickly or have them stand up quickly. So for this reason, it's advisable to raise the patient to a sitting position and then ask them to remain sitting for a short period of time before standing. Okay, just tell them you've been laying down on your head for quite a while. Get up quickly. Get up slowly. Don't rush out of here. Take your time. Okay, you don't want them to suddenly get dizzy and fall over and then have yourself an unnecessary medical emergency in your office. Okay, an allergic reaction may be caused by drugs, toothpaste, latex, or other dental materials that patients may have an allergy to. They may vary in severity. It can also cause skin reactions like edema, erythema, vesicle formation, urticaria, and angioedema. So an anaphylactic reaction is a severe reaction to an allergen such as peanuts, a bee sting, or exposure to penicillin or anesthetics. So this is a severe life-threatening allergic reaction where the body creates large amounts of histamine and it flushes it through the body, causing like this immune response. Can also cause the tongue and throat to swell, which is an even scarier condition because obviously that'll obstruct the airway and we need oxygen to breathe. So some signs and symptoms of anaphylactic are loss of consciousness, a skin rash, drop in blood pressure, nausea and vomiting, shortness of breath, and the tongue and throat swell. So the patient showing signs of anaphylaxis is a life-threatening situation, and immediate action should be taken to help this patient. Okay, epinephrine should be administered as soon as an anaphylactic response begins. Many patients with the known severe allergies often carry their own EpiPens, but if they don't, this is another reason why you want to update your office's emergency medical kit, because an EpiPen should be kept in that kit, or at least some type of injectable epinephrine. Some causes of hyperventilation, which is a deep and rapid breathing. Okay, with this, this results in the loss of carbon dioxide in the blood. And so some of the symptoms include faintness or numbness. So hyperventilation can occur as a result of anxiety. Properly preparing the patient for treatment by explaining this treatment or by explaining the treatment and the expectations of the treatment while allowing the patient to ask questions and addressing patient concerns can help to prevent hyperventilation. So the treatment of hyperventilation is you want to sit the patient upright and then have him or her breathe into a paper bag. Okay, if they don't have a paper bag handy, have them cup their hands and then breathe in and out through their hands. This will have them increase the amount of carbon dioxide in their blood and should help to have them start breathing normally again. Okay, my mouse just froze, so give me a second, it will come back so I can get on to the next page. Anybody have any questions or comments so far? Okay, good. Come on, mouse. I have a magic mouse. It's not so magic right now. Sometimes it stops, so I apologize. All right, any minute now. There we go. Okay. So an epilepsy or a seizure disorder is when we have unorganized charges in the brain that cause change in consciousness. And this can be minimal and can also be severe. So the most common seizure is the grand mal seizure. This is when the patient becomes unconscious and the body jerks and twists and stiffens. Breathing may be irregular and they may lose control of their bowels and their bladder when the seizure is over. So this can last anywhere from 2 to 5 minutes. The petit mal seizure is a momentary loss of consciousness. This is exhibited by a blank stare or a blinking of the eyes that lasts 5 to 10 seconds. A partial seizure can be classified as a simple or complex seizure. The simple seizure is characterized by twitching of the body, but the patient remains conscious. The complex seizure may exhibit with involuntary actions followed by twitching of the body. So when a patient experiences a seizure, you want to stop all treatment and remove all the objects and materials from their mouth as soon as possible. You want to let the seizure run its course and monitor the patient to maintain the patient's safety. So do not restrain the patient, but what you do want to do is you want to protect their head. So that means kind of hugging their head, don't squeeze their head, but just kind of keep it, put your hands underneath their head. So if they're, thrashing around, they're not injuring their head, causing themselves more of an injury. So once the patient has stopped seizing, place the patient in a comfortable position and allow the patient to recover. and you want to offer assurance. So the patient may be disoriented or exhausted. They may not remember the seizure. And because they may have lost control of their bladder or bowel, they may be very embarrassed. So you want to offer them reassurance, let them know it's okay. These things happen. Don't be embarrassed. Just, we'll clean this up, things like that. What you definitely don't want to do is you want to start laughing, call your friends over here. Hey, come here, look what this patient just did. Okay, don't ever do any of that. Okay, this patient has no control over that, and you wouldn't want to have somebody do that to you, basically. So. All right, so type 1 diabetes. So this, the book erroneously labeled it juvenile diabetes. Okay, I say erroneous because once people have type 1 diabetes, it's not something that goes away. You have it for life. It mostly affects ages, or starts in ages 10 to 16 years of age, but I've seen it as young as babies with 2 months old. And it even starts as late as 20 to 30 years old. Okay, this is usually associated often with additional medical problems. They require daily insulin injections, and this is the most severe form of the disease. So I just want to make sure everybody's educated with this. Type 1 diabetes is very different from type 2 diabetes. Okay, type 1 diabetes is not caused by bad or poor diet. It's not caused by not exercising or things like that. So type 1 diabetes is actually an autoimmune issue. So when somebody, let's say a child they might have like something small, like it could be a flu or a common cold or pneumonia. Okay, what happens is the body overreacts, the white blood cells go crazy. Okay, and what they will do is they'll actually get into the pancreas, and they'll attack the pancreas's basal cells, which are responsible for producing insulin. And so what it does is it permanently damages the patient's pancreas, so that the patient can no longer produce their own insulin. And so this is why patients will have to administer their own insulin injections basically for the rest of their life. Okay. So you want to monitor these patients closely. And this comprises about 10% of diabetes cases. Type 2 diabetes is usually called adult onset diabetes. This is usually controlled with diet and or hypoglycemics. It does not usually require insulin injections unless it's become very advanced. And this is most often seen in obese adults or adults over the age of 40. So this type of diabetes occurs as one ages and is becoming more prevalent in the US. And this is one that can be controlled and sometimes even cured with diet and medication. Okay, so hyperglycemia is a type of diabetic complication. It is known as high blood sugar levels. So with this, the patient usually has eaten but has not taken their insulin or not taken enough insulin. So they have too much sugar, which is glucose in the blood. So the onset of hyperglycemia is slow, and the patient may show signs of increased thirst, increased urination, nausea, vomiting, loss of appetite, fatigue, and pain. Okay, just a short story. My daughter actually has type 1 diabetes. And because I knew what the symptoms were, I learned this in dental assisting school, I was able to actually catch this very early. When I noticed she started wanting to drink too much water, she had to go to the bathroom, she actually vomited. I thought right away, this is hyperglycemia. I know what this looks like. Okay, we took her to the doctor, and sure enough, she had type 1 diabetes. We caught it quickly enough to where she wasn't, thank God, she didn't go into a coma or she wasn't hospitalized. Okay, so this is something that patients like her will have to deal with for the rest of their life, but it can be controlled, and there are very good outcomes as far as like the technology has advanced more. So there's things like insulin pumps and constant glucose monitors that can help patient with control hyperglycemia and hypoglycemia, which we'll go over in just a second. So some signs of hyperglycemia, which is, remember, this is high blood sugar, increased thirst or dry mouth, excessive urination. Their breath will smell like acetone. They'll have blurred vision, a rapid pulse, low blood pressure, and a loss of consciousness. So treatments for patients with hyperglycemia, if it has become so advanced, it is known as diabetic ketoacidosis, or they can even go into coma. Okay, so if a patient is conscious, you want to have the patient administer their own insulin if it's available. Okay, if they are unconscious, that's because they have gone into diabetic coma. So you'll need to provide basic life support. Okay, this is a life-threatening event if they're unconscious, and they should be transported to a medical facility as early as possible. If a patient has hypoglycemia, this is low blood sugar. So the causes of hypoglycemia are overexertion, emotional stress, missing meals, they took too much insulin, or they exercised too much with too much insulin in their body. So this condition can be rapid. It can come about very quickly, and it can be brought about by missing a meal, overexertion, or emotional stress and anxiety. So some signs and symptoms of hypoglycemia, or another word is insulin shock. They may have cold sweats, nervousness, trembling, weakness, hunger. They'll have a personality change. They may even be confused. Okay, so people that don't have diabetics can have low blood sugar. Okay, so we often experience this when we haven't eaten all day. So think about the days that you forget to eat or don't have time to eat, and suddenly it's 8 o'clock at night and you're having some of these symptoms. So this is what somebody with diabetes that has hypoglycemia will feel. And so you should be able to recognize these and be able to treat them accordingly. So if a patient is conscious and they have hypoglycemia, have them administer some type of sugar source. Give them soda, give them cake icing. Orange juice is another good one. Crackers, things that have high amounts of carbs. Usually a liquid sugar source is going to be the most fast acting. If they're unconscious, this is definitely a life-threatening situation. Okay, with this, you want to give them injections of glucagon. Glucagon is an injectable drug that should be kept in your office's medical or emergency medical supply. Glucagon is not sugar. What it does is it stimulates the body's liver to start producing its own sugar very, very quickly. And then you want to hit it with a double whammy. So you want to give them some type of sugar source. Because they're unconscious, you'll need to place it underneath their tongue or on their buccal fold, so inside of their cheek, and then wait for them to become conscious again, and then give them more like orange juice or soda or something like that. Okay, so now we're talking about angina. So angina is a type of chest pain. So this is pain in the chest area, the neck, or the jaw. It usually has about a 5-minute duration. And what it is an increased blood pressure and pulse. The patient may appear pale with clammy skin. So when a person is experiencing angina, the person will want to remain motionless and stop all activities. Many people with angina may be under the care of a physician and may carry nitroglycerin with them. Nitroglycerin is placed under the tongue to help relieve the chest pain. My daughter just got home, so my dog is saying hi.
Sorry.
It's okay. So up to 3 doses may be administered if symptoms are not alleviated with the first or second dose. So the patient should be encouraged to be transported to medical safety if necessary. So what nitroglycerin does is it dilates the coronal arteries or the coronary arteries, so it makes them bigger. And this is so that the heart receives more oxygen. So myocardial infarction is a fancy term for a heart attack. So myocardial infarction means the tissues of the heart start to die. So this is caused by a blocked or narrow artery or arteries, and the symptoms are similar to angina, but are not relieved with the administration of nitroglycerin. So about 1/3 of heart attack victims die, unfortunately. So once again, the myocardial infarction, heart tissue dies. So this is a condition that causes sudden death of the heart tissue due to a blockage of the heart vessels. And it may be preceded by angina. So it may start with angina, but also may occur in people with no prior symptoms. Mouse goes dying again. Sorry about that. Any questions with myocardial infarction? Something like that. So when somebody is having chest pain, we want to treat it first as angina. So give them that nitroglycerin. If the nitroglycerin isn't helping their chest pain within 5 minutes, we want to assume that it's a heart attack. So we're going to treat it accordingly after that. So the treatment of myocardial infarction, you should immediately call 911, position the patient comfortably, start administering oxygen, administer nitroglycerin if you haven't already, and then you want to give them aspirin. So this is 160 to 325 milligrams of chewable aspirin. Okay, so normal dosage of over-the-counter aspirin is usually about 81 milligrams. So if you're giving them 160 to 325, you want to give them 2 to 4 pills of chewable aspirin. Okay, and have them chew it. And the reason why we want chewable aspirin is because we want them to start digesting it quickly. We want to get them to put it in their bloodstream as soon as possible. So people with chronic medical conditions or poor cardiovascular health may experience a weakening of the heart, resulting in CHF, which is congestive heart failure, or the inability of the heart to pump fluids throughout the body. So fluids will end up building up in the ankles and legs, and patients with CHF are weak and may have difficulty breathing. So diuretics are often administered to reduce the fluid buildup and hopefully help to relieve some of that congestive heart failure. So stroke or CVA, which is a cerebrovascular accident, is caused by an interruption of blood flow to the brain. So patients may exhibit signs of dizziness, sudden and intense headache, loss of speech, weakness, numbness, paralysis on one side of the body, or including their face. So you want to look for droopiness on one side of the face. Okay, that's a telltale sign of a CVA. Loss of consciousness is another one. So treatment in a stroke center or the emergency room is necessary. So you want to definitely administer oxygen and call the EMS or 911 as soon as possible. Dental emergencies include abscessed teeth, which is an infection in the tooth. Here, the patient will have pain, swelling, and a severe response to heat. Alveolitis is a term for dry socket, where we have nerve endings over the bone that's exposed. So patients that have had an extraction and for whatever reason, they used a straw when they weren't supposed to, they smoked right after, they'll have nerve endings in the socket that become exposed, and it's a very, very painful situation. A false tooth is when the tooth is forcibly removed, and it can be replanted if done quickly. So oftentimes you'll hear patients come in, they're in soccer or they're in hockey or whatever, and they got their tooth knocked out of their head. They'll come in with a tooth sitting in milk. Okay, that's a great idea. That helps to keep the tooth moistened, and a lot of times it can be reimplanted. Okay, a broken prosthesis is like a broken partial or broken denture or something like that. Here you'll have appearance concerns or loss of function. Soft tissue injury is usually caused by sharp or blunted objects, electrical burns or sports injury. Broken tooth is commonly, teeth are commonly fractured from drinking faucets, steering wheels, or diving boards. Loose or permanent temporary crowns usually require some type of re-cementation. All right, who can tell me what the dental emergency shown here is? Somebody other than Amarani. Okay, Brianna, what do you think this is?
I don't remember like the medical term for it, so I'm just gonna say like cracked tooth.
Very close. It's a broken tooth.
Okay.
So yeah,
Okay, cool.
good here the tooth is completely broken. So with this, a lot of the times if the break enters the pulp chamber, this can be very, very painful. So you'll want to, a lot of times when this happens, it's because somebody just got in a car accident or they got in a sports accident. They took a baseball to the teeth, something like that. So usually what we'll want to do is give them anesthetics as soon as possible to get them numb to relieve some of that pain. And if it exposed the pulp, oftentimes a root canal will be necessary to permanently remove the pain. Okay, good job, thank you. So monitoring patients during treatment is very important. You want to also, like, let's say, especially if they're in sedation, you want to use devices like a pulse oximeter, a capnograph, and an electrocardiogram if necessary, especially if they're under sedation. So a pulse oximeter is used to measure the oxygen saturation of a patient's blood, changes in blood volume in the skin, and the pulse. It's non-invasive. All it is a little device that goes over the person's fingernail. Hypoxia is a pathological condition in which the whole body or a small region of the body is deprived of adequate oxygen supply. A pulse of 90 to 95% may give the pulse oximeter a reading of mild to moderate hypoxia. So we want to be as close to 100% oxygen as possible. So anybody with the pulse lower than 90% or with anything with a blood saturation of lower than 90% is cause for concern. A capnograph measures the absorption of infrared light, which is absorbed well by carbon dioxide. So it is often part of the pulse oximeter or medical device. A saturometer is placed on the fingernail, and that's the typical way that most patients are monitored. Capnometry is a measurement and numerical display of the maximum inhalation and expiratory CO2 concentrations during a respiratory cycle or a breath. Moderate to severe hypoxia is represented by a pulse of about 80 to 90%. Okay, and lastly, an electrocardiogram records electrical activity of the heart. It's non-invasive. Electrocardiography is the recording of the electrical activity of the heart for a period of time by way of skin electrodes. Like I said, it's non-invasive, and then such sensors and electrodes detect electrical impulses on the skin and also detects alterations in the pumping of the heart. Okay, any questions with this so far? Okay, all right. So we're going to go on to chapter 4. Okay. So with chapter 4, we're talking about oral and health techniques. And what we're going to go over is we're first of all going to describe how plaque forms on the teeth. We'll identify some oral hygiene tips and that will affect certain age groups. We'll identify the oral hygiene aids, including manual and automatic toothbrushes. We'll demonstrate some toothbrushing techniques, identify types of dental floss, describe fluoride and its use in dentistry. And then we'll list and explain the forms of fluoride and describe how to prepare a patient and demonstrate a fluoride application. Okay, so preventative dentistry also means we want to prevent the formation of plaque. Plaque can cause demineralization of the tooth, which is the very starts of cavities, and it'll progress into dental decay or caries. Okay, so the sugar dental decay equation is sugar plus plaque equals acid plus the tooth, which equals decay. So one of the responsibilities of the dental assistant is to help make oral hygiene a positive experience for the patient. To do this, a dental assistant should treat the patient as an individual, taking into consideration the patient's age, oral hygiene, knowledge, skills, attitude, and special considerations. This will help enable the dental assistant to work as a partner with the patient to set goals and keep the patient motivated. Hang on, I'm losing light here. Now you can see me. All right. So oral hygiene in infants is very important, but an infant can't attend to these needs alone, obviously. So the parent or caregiver is an integral part of the process in the oral hygiene of the infant. The dental assistant should demonstrate techniques to care for the infant's oral hygiene, and you should be able to instruct parents how to do this, because a lot of times parents just don't know. They could be their first child, they've never done this before. So you want to help them to help their infants. So it is at this age that the child goes to the dentist for the first time usually and begins to learn how to use a toothbrush. The experience should be positive and good dental practices should be encouraged and reinforced. So this is usually around age 1 to 3 years old. The dental assistant should demonstrate to the child the tools used while in the dental office and provide suggestions to parents on encouraging and teaching oral hygiene skills at home. So you want to make this a fun visit. You want to make it so that it's not scary. Use very layman's terms. When I used to work in pediatrics, I used to, you want to try to act like a Disney character as much as possible. Okay, that will usually get their attention. It usually prevents them from being scared. Show them everything that you're doing. Give certain instruments cute or funny names, like the suction. I would call Mr. Thirsty. I would, the X-ray sensor, I'll call it a cookie or a cracker. Things that will get their attention and not scare them away. So children ages 5 through 8, children in this age group can begin to take a more active role in the oral hygiene. Their attention spans begin to increase. Brushing and flossing skills can be taught and practiced. Videos, cartoons, and pictures can help with these skills. And children at this age like to learn and strive to please the adults in their lives. Children ages 9 through 12 often become concerned with fitting in. So it's very important for children at this age to fit within their peer group. This age group is proficient in the oral hygiene. Further teaching can be done through the use of realistic visual aids. Rewards work well with this age group, and instruction may be needed to be given on how to care for mixed dentition, so where they have baby teeth and adult teeth in their head. And mixed dentition is usually found in this age group. Okay, children ages 13 to 15 are usually motivated by peer pressure and personal appearance. This age group is very concerned with the way they look. They are more frequently in the company of their peers, and nutrition becomes poor due to increased snacking. Dental hygiene may become lax in this area also. So the dental assistant will need to teach and motivate based on individual needs, knowledge, and skills. So children ages 16 through 19 like to question authority. Okay, so young children question authority figures in this age, and at this time feel they don't need any additional help. So their lives become very busy and active socially. Personal appearance continues to be very important, and the dental assistant can keep this age group motivated by allowing them more control and teaching them about the importance of clean breath and a healthy smile. It helps this age group to know that they are getting what they're getting out of it. So if you tell them, you tell like a young teenage boy, for example, that has terrible hygiene, hey, girls don't really like bad breath, or they really don't like yellow teeth. Or the flip side, you have a young girl that said, hey, you don't really want, you don't want your friends to be start making fun of you or stuff because you have bad breath, or something like that, something to get them motivated. So adults ages 19 through 60, this is when they start to unlearn their bad habits. So at this age, oral hygiene becomes maintenance, and the dental assistant can aid the patient by identifying and helping correct bad habits. Gingivitis, which is inflammation of the gingival tissues, may develop between the ages of 20 through 60. And the patient may see bleeding in the mouth and tend to not take care of that area because it's bleeding or because it's inflamed. Okay, so this only exacerbates the area. So the dental assistant can educate the patient that it is important to brush and floss around the inflamed area and more in order to remove the plaque and allow the tissues to heal. So adults over the age of 60 have the desire to keep their teeth. So aging is a natural process, but some declines in health resulting from aging may have adverse effects on the oral health. So the dental assistant can help identify problems and restore them so that the patient can maintain their dentition. They want to keep their teeth as much as possible. Special care may need to be taught for those who need restorations and appliances due to tooth loss. And you want to listen to the patient and maintain an accurate health history in order to address oral care issues. Okay, so with preventative dentistry, a dental all-stars bulletin board may help motivate which age group achieve proper dental hygiene. Who can tell me this? Okay, who should I pick on? Lolly.
With the age group,
Yeah.
preschool, 1 to 4 years old, maybe.
Ooh, close.
Oh.
Ages 9 through 12. So ages 9
That's
through
not
12
close, but
usually
okay.
they usually need some type of motivation, and creating an all-stars bulletin board. So this is when kids are still kids. They haven't really got to the teenage years yet. So you can still use something like this. But it's a little bit more advanced than like acting like a Disney character or something like that. Okay, thank you for that. So with home care, you want to make it simple. You want to be specific to the patient and their goals. Encourage them, set expectations, and develop daily routines. So the easier it is to achieve, the more compliant patients will be. Tailor ideas for creating a daily routine to the individual patient's goals. So like if you want to get them to floss regularly, have them tie it to something that they do every day. So let's say they take a shower every day. Well, there's nothing wrong with flossing in the shower. Bring your floss into the shower with you. Maybe they like to see their favorite episode of Grey's Anatomy every day. Okay, it's a little gross flossing on the couch, but hey, if you're going to do it sometime, do it then. So you want to set expectations and provide encouragement to motivate patients to continue the care and treatments. So it is important for the dental assistant to be familiar with all oral hygiene aids available on the market. So when suggesting one to the patient, keep in mind the less steps involved with the usage, the better. Mouth rinses purchased at the grocery store generally contain about 0.05 sodium fluoride and can be used daily. So prescribed fluoride generally contains about 0.2% of sodium fluoride or 0.6% stannous fluoride. This fluoride is prescribed to patients with a high incidence of decay and may be used for decreasing sensitivity. So there are special mouth rinses. Even chewing gum can help, only if it's sugar-free, of course. But the chewing gum will actually help remove some plaque if they're having an issue with that. Interdental aids can help to clean the area between the teeth, and they may actually stimulate the gingival tissue or the gum tissue in this area. Some of the uses of interproximal brushes is for patients who have open contacts or areas of substantial amount of bone loss due to periodontal disease. So these are things like an interproximal brush, a rubber or wooden dental stimulator, a floss threader, floss holders, or a water irrigation device like a water pick. All right, so if a patient has open contacts or an open bifurcation or trifurcation areas, what dental device might this dental assistant help to teach the patient to use? Who can take a guess?
Interproximal brushes.
Ooh, that's a good one. Yes, you're right. Interproximal brushes. Good job. Yeah, so that can be like if a patient has bifurcation or trifurcation areas, what that means is that's the area where the roots split. So you have a tooth here and then it'll have roots that go down. So in that area where the root split, that is known as a furcation area. And so when that becomes exposed, you might have them use an interproximal brush to get in between the roots. This is usually somebody with severe periodontal disease, but it can help to keep those areas clean and prevent the gum tissue from dropping even more. Okay, good job. So the dental assistant should know the proper techniques and methods for brushing and be able to teach the patient these techniques and methods. The dental assistant must be familiar with the motions of the mechanical toothbrushes. So some of them are reciprocating, some of them, or they go back and forth. Some of them are orbital where they spin. Some of them vibrate like a Sonicare. Some of them are elliptical or a combination of the two or more of these. And then also manual toothbrushes, they have their different parts that you want to be aware of, like the handle, the shank, and then the brushing plane. And so with manual toothbrushes, you never want to go in a back and forth motion. That'll actually help erode the gum tissue. Instead, it should be circular motions, okay? So as an early advocate of preventive dentistry, a man by the name of Dr. C. Bass developed the Bass or modified Bass brushing technique, which is used to remove plaque next to and beneath the gum, the gingival margin. So in the Bass technique, the tips of the bristles are directed straight into the gingival area or the gingival sulcus, like you see here in this picture. And you want to vibrate back and forth with short, light strokes or a count of 10 before moving on to the next area. So the Charters brushing technique is similar to the Bass brushing technique, except for the angle of the toothbrush placement. So with this angle, it stimulates the gingiva, both marginal and interdental. So that right at the margins of the gum tissue or in between the teeth. With the modified Stillman technique, the bristles are pointed apically, so towards the roots of the teeth. Here, the bristles rotate downward and vibrate back and forth until the brush has rotated over the entire surface of the tooth. This technique is used for good overall cleaning, the removal of plaque, and to stimulate and massage the gingiva. With the rolling stroke brushing technique, the bristles are pointed upward for the maxillary arch and downward for the mandibular arch. The bristles are pressed firmly but gently rest against the gingiva and are rolled slowly over the tissue and teeth toward the biting surface. So it's like a rolling stroke, okay? The Fonez brushing technique is an easy to learn first technique, and it's great for children. With closed teeth, we want to use circular strokes with a sweeping motion. The modified scrub is a back and forth scrubbing motion, and it's used to remove plaque and stimulate the gingival tissue. So the modified scrub is usually not recommended just because of how traumatic it can be to the gum tissue. But if somebody is accustomed to using the modified scrub, make sure they're using a soft bristle toothbrush. In fact, I don't even know why medium or hard bristle toothbrushes are on the market anymore, probably because people buy them still. But definitely soft bristle toothbrush should be the way to go for everybody. Tongue brushing is important because bacteria can collect on the top of the tongue. So what we want to use is something called a tongue scraper. And it just looks like a plastic loop with like little spikes on it. And we want to use it to, and we can use, you can use that to scrape actually all the plaque and bacteria off the tooth. Or if you don't have a tongue scraper, you can use a toothbrush to scrub back and forth. But the idea is you want to get the plaque or that white film that sometimes collects on the tongue off of the teeth, or excuse me, off the tongue so that you don't get bad breath. The different types of dental floss include unwaxed, lightly waxed, non-shredding, extra fine, large flat tape, or tufted texture, so that when tightened changes size. So floss also comes in different colors and flavors that may be appealing to the patient. And the type of floss is used is not as important as the way or how often the patient flosses. So whatever you can get them to use that. So the dental assistant should have a knowledge of the various types of prosthetic devices in order to educate the patient on hygiene and techniques to that specific type of appliance. So these are things like fixed bridges, implants, full or partial dentures, and orthodontic appliances like brackets, wires, or retainers. So it's very important for the dental assistant to listen and problem solve with the patient who has special needs. So when working with a patient who is either mentally or physically compromised, the dental assistant has to be creative in order to meet their specific goals for the hygiene for that patient. An example would be suggesting a toothbrush with a large, soft handle for an elderly patient or somebody with arthritis. Patients with cancer or patients even that take a lot of medications can often get xerostomia, which is abnormal mouth dryness. And patients with heart disease can have bleeding gums. Also, patients who are older. So a little bit of the history of fluoride. So in the 1900s, Dr. G.V. Black and Dr. F. McKay discovered people with discolorations on their teeth had less decay. In the 1930s, it was discovered that there was a connection between the fluoride and mottled enamel. Eventually, an optimum level of fluoride was used to prevent dental caries. So the optimum level is 1 part per million. Grand Rapids, Michigan was the first city to test the benefits of fluoride through fluoridation. It reduced dental caries by 60%. However, it is controversial. It has been a controversial issue for many areas. And it's important for the dental assistant to have current knowledge on fluoridation in their communities so that they will be prepared to answer patient questions. Fluoride is important for the development of healthy teeth and bones. And it's more important for a child to get fluoride than an older person. Fluoride affects the tooth both during pre-eruption and post-eruption. So when fluoride is in plaque, it helps inhibit the production of acids that are responsible for tooth decay. So fluoride can be toxic, however, with the level of toxicity depending on the duration and dosage of ingestion. So you don't really want people to swallow this stuff. It's beneficial for the dental assistant to have the knowledge of possibilities of fluoride poisoning and when and where it has occurred. The amount of benefits an individual receives from fluoride depend on the length of time the individual received the fluoride and the amount given. The benefits include reduction of dental caries, reduction for the need of extensive dental care, primary teeth lost prematurely to decay, reduction for the need of orthodontic treatment, and improved bone density. And with a healthier bone and less decay, the periodontal tissues like the gum and bone also stay healthier. Fluoridated water, foods with fluoride, fluoride tablets, and drops are all sources of systemic fluoride. Topical fluoride comes in gels, rinses, foams, and liquids. Also, there are several flavors from which the patient can choose. The 1.23% acidulated phosphate fluoride, or APF, is commonly preferred. The application involves a prophylaxis, isolation, and drying of the teeth, and then application of the solution, gel, or foam in 1 or 4 minute increments. Fluoride varnish is usually applied to the coronal surface. So this is usually the more modern type of fluoride that we use in the dental office. Contains about 5% fluoride in an alcohol solution with natural resins. The advantage of fluoride varnish is that can oftentimes remineralize incipient caries. So these are like baby cavities that have just barely started. They haven't gotten through the enamel yet. Okay, these can actually be reversed with fluoride varnish. They can also help stop micro leakage from happening. So sometimes when we get those white fillings, over time, those will start to shrink and they'll start to leak bacteria underneath them, which will cause or can cause recurrent decay. If people have hypersensitivity, usually due to like receding gum tissue, this can help with that. So what you'll do is you'll place that fluoride varnish right in those areas where the gum tissue has kind of been pulled down a little bit. And oftentimes this will help with hypersensitivity. Fluoride rinses should be used after cleaning the teeth So after you do that, you want to apply the liquid rinse. A lot of times these don't really taste very well. And patients must be reminded not to swallow because we don't really want to ingest fluoride. We just want to use it as a topical solution. Okay, who can tell me what 3 minerals are essential for healthy bones and teeth?
I know one is calcium, right?
Yes.
That's all I got.
Thank you. All right, I'm not sure that I actually went over this, so I'll just kind of give this one to you.
Vitamins?
Vitamins are important, yeah. Let's see what we got here. So we need fluoride, calcium, and phosphorus. So those are the main 3 minerals that are essential for healthy bones and teeth. All right, anybody have any questions with any of these? Okay, so please be aware of what needs to be done today. There's quite a bit that you'll see on the content folder for today. So I want you to get a decent start on that. Your oral health presentations are coming up. So the next time we meet will be actually when you will be presenting those. Okay, so I need for you to submit your topic. I need that to be done before tonight. For tomorrow, or let's see, today's Wednesday, so yeah, tomorrow is when you'll present your project. So I need for you to submit your PowerPoint presentation before 5:30 so that I have it. That way I can pull it up on the projector if you're going to use it to present to the class. Okay. Any question with any of that?
What folder are we submitting our topic? Because I was looking and there's only a thing to submit the presentation itself, not the actual topic. So is there a specific folder
Yeah, so
or
it should be
that it was in?
and it should be in today's content. Here, I'll pull it up just so that we're all on the same page. Here, let me change my screen sharing. Okay, so let's go into the content. I'll just log in here really quick. Okay, so it'll be in distance learning, should be in week 2. Sorry, week 3. Losing count of my weeks here. And then today's folder, if you scroll all the way down where it says 88 oral health topic submission. So this is just simply putting it in a Word document. This isn't actually the PowerPoint presentation. That's not due till tomorrow before 5:30, but you're going to use this link to submit your topic. So all you have to do is provide to me your topic. So that shouldn't take any more than 5 minutes. And then for tomorrow's is where you'll actually submit the oral health the PowerPoint presentation. Oh, I see what you're saying. So this is where I don't know why it's in this folder. It shouldn't be, but I'm going to keep it there just so that we're all on the same page. I don't want to move it because when I start doing that, people will really get lost. So this is where you'll present the topic for tonight, for tonight's assignment. By tomorrow, this is the link that you'll use to actually submit your PowerPoint. Does that make sense? So it'll all be in tonight's folder.
I'm not seeing it in the folder.
Yeah, I see this, the PowerPoint submission, but I'm not seeing the topic submission on my
Yeah,
end.
neither am I.
It's probably because it says hidden for students. Hold, please.
Okay, so I
Ta-da.
turned in my PowerPoint.
Oh, you did? Okay.
Yes.
Do me a favor, just turn it into again to the health topic submission. Who said that? Was that Amarani?
Yes.
Okay, so I'll go ahead and clear that submission for you. Just do me a favor and turn it into the health topic submission. That was my fault. I apologize. It should be available to you now. And then that way, when you're ready to submit your actual PowerPoint presentation, it should be clear for you. Okay, did anybody else do that? That I need to clear? No, okay. All right, is that pretty clear? Any other questions I can answer before we go?
Can you open tomorrow's homework stuff so I can get advanced on that?
Yeah, I'm surprised it's not open. I'm so sorry.
No, you're good. Thank you.
Done. Okay. All right. Anything else? Okay, if you maybe you can think of anything, please don't hesitate to email me. I'll try to respond as quickly as possible, especially now that I know that's coming down to the wire. I don't want anybody to feel like they're not really understanding anything. So please don't hesitate to reach out to me and I'll help as quickly as possible. Okay.
Also, one more question, sorry.
All right. No, go for it.
For the topics, if we
Uh-huh.
have the same topic as someone else, are you gonna tell us to choose a different topic or?
No, that's okay. No, you can do
Okay.
that.
Okay, cool.
Okay.
Thank you.
All right, so if nobody has any other questions, I'll end it here. Go ahead and get started with your assignments. And then, like I said, please email me if you have any questions. All right. All right, well, have a good night, everybody, and I will see you all tomorrow. All right, bye.